Okay guys, Timmy coming at you here, and today what I want to do is explain to you the signs and symptoms of hyper and hypothyroidism. Alright, so let's look at this for a minute. If you recall, one of the effects of thyroid hormone, both T3 and T4, on the cells of the body, because thyroid hormone controls your basal metabolic rate, or basically how many calories you burn at rest. Thyroid greatly affects that. And we learned that all cells are leaky to sodium, and all cells are leaky to potassium, right? So sodium wants to leak in, potassium wants to leak out, and what maintains that concentration of sodium and potassium inside the cell and the blood is the fact that when sodium leaks in, you have the sodium-potassium pump, which takes 3 sodiums that are inside the cell and pumps them back out. And at the same time, it's going to take 2 potassiums that leaked out and pump them back in. And this is ATP dependent. It requires ATP. And your metabolism, your metabolic pathway, creates that ATP. Now, as I explained to you before, with thyroid hormone, it makes cells more leaky to sodium and potassium. So if the cells become more leaky to sodium and potassium, then the sodium-potassium pump has to work harder in order to maintain the concentration of sodium and potassium in the blood. Now, because of that, you're going to need more ATP to drive that sodium-potassium pump. That is going to increase metabolism, right? You're going to burn more stuff. So one of the symptoms of hyperthyroidism is weight loss, right? Person just starts dropping a bunch of weight. The other thing is that if you remember, when you break that third phosphate off of ATP to make the pump work, one of the byproducts is heat. So they're going to have an intolerance to the heat. So they're going to be complaining that they're hot all the time. Now again, everybody's entitled to their own opinion. You get that one? Anyways, so that's the big effect. The other effect is that thyroid hormone increases cells' sensitivity to epinephrine, epi, and the effects of the sympathetic nervous system. So basically, your fight or flight response is going to be turned on all the time, right? So that's going to increase your heart rate. It's going to increase your blood pressure, right? If you're scared, you can't sleep, so they develop insomnia. And they're going to be anxious, jittery, right? Not going to have a lot of patience. Maybe I should have my thyroid checked. The lack of patience. Just playing. The other thing that happens is you get a condition called exophthalmos. And basically what happens is that your eyes start bulging out. And the reason for that is there is a thickening of the protein and fat behind the eye. There's also a thickening and fibrosis of the extraocular muscles. Now, if that hyperthyroidism isn't treated, then that can be permanent. It can be reversed now, but it has to be caught relatively early. So let's go through the list of the signs and symptoms of hyperthyroidism. All right. So one, a big increase in your metabolic rate, right? Also, epinephrine and norepinephrine, they increase your metabolic rate in cells too, right? So that's why people who take speed, right? Speed mimics the sympathetic nervous system. So that's going to increase your metabolic rate, and under the effects of epinephrine, you're not going to get hungry, right? So you are not going to eat. So if your metabolic rate's high and you're not eating, you're going to lose weight. And then I discussed the elevated body temperature, the weight loss, I explained that. The increased cell sensitivity to epinephrine and norepinephrine, especially the heart. And then hair loss, because remember that thyroid hormone increases cell division, and the basal layer of your skin divides more frequently, and as a result the hair can thin. Now the opposite is true in hypothyroidism, more on that later. And here's the thing, the skin divides so rapidly that it doesn't have time to keratinize, so it will actually just peel off. Just real quick, a story. I had a lady come in and she had Graves' disease, right, undiagnosed, and her feet were killing her, so she took off her shoes and her socks, and when she took off her socks, basically the bottom of the skin on her bottom of her feet just literally peeled off, and it looked nasty. The exophthalmos, that's what I was explaining to you about, the thickening of the fat and protein behind the eye as well as the eye muscles. And they will get diarrhea due to increased GI activity. So basically in hyperthyroidism, everything is hyped up. And then they're going to be hyperreflexive, shaky, jittery, anxious, and then they can't sleep. And then they get this peritibital myxedema, and basically it's thickening of the collagen around the legs and the feet sometimes. So those are really the signs and symptoms of hyperthyroidism. And remember that one of the big causes of hyperthyroidism is Graves' disease. So in Graves' disease, basically what happens is there's an antibody. Let me show you. Now, so Graves' disease is an autoimmune disease, and you got your thyroid gland cell. And you have TSH receptors. If you notice in my videos, I make all my receptors the same. Shouldn't do that. But anyways, I digress. Now, normally TSH released from the anterior pituitary, TSH, the hormone, right? That's going to stimulate TSH receptors and begin the production of T4 in the thyroid gland. Well, you have floating around in your blood and your lymphatic system, you have B cells. And B cells are part of your specific immunity. And what B cells will do is they will start producing antibodies. A fancy word for antibody is immunoglobulin, right? So they're going to produce these antibodies, which are proteins, right? And hormones are proteins. And these antibodies that are produced instead of destroying something, these antibodies will actually stimulate TSH receptors. And by stimulating that, then what do? You activate the iodine pumps in the thyroid gland, and you begin the production of T4. Then you get this increased production of T4. T4, as we remember, goes to the liver and gets converted to T3. Hence, hyperthyroidism. Now, these antibodies also stimulate the hypertrophy, the increased growth of thyroid gland cells. So these people will develop a goiter as well. So, look, you can get a goiter from hypothyroidism, but that's relatively rare. And the reason it's rare is because in hypothyroidism, a goiter will develop as a result of lack of iodine. Well, the American diet is, you get plenty of iodine with Morton's iodized salt, right? So if a person has a goiter, that's usually more indicative of hyperthyroidism or thyroid cancer. So the signs and symptoms of Graves' disease are basically hyperthyroidism, right? The signs and symptoms of hyperthyroidism. Now, there is some other differences. One is you can develop what's called thyrotoxicosis, and that's basically a massive increase in production of T4 and results in the increased production of T3. Now, this is important, and clinically, this is very important for you to understand. So, what happens, if you remember, is both T4 and T3, and I'll make big T3 because T3 is the most, it's like 4 or 5 times more active, powerful than T4. They both increase cell sensitivity, right, to epinephrine and norepinephrine, right? So epi in the sympathetic nervous system. And what that can do is that can increase your heart rate and make your heart rate, the electrical conduction system of your heart, very irritable. And the result is that you can go into ventricular fibrillation and die. Now, what you want to do is, the first thing you want to do when someone is diagnosed with Graves' disease is you want to, very important, protect the heart. Now, what does T3 and T4 do to norepinephrine and epinephrine? It increases the heart sensitivity to that. So that's why your heart rate is up and your blood pressure's up. And we know, well, maybe if you don't know, I'm going to explain it to you now, that in order to increase your heart rate and blood pressure with the effects of epinephrine is that epinephrine has to bind with epinephrine receptors in the heart, and epinephrine receptors have a name. They're called beta receptors. And in the heart, you have beta 1 receptors. So if thyroid hormone increases cell sensitivity to epinephrine and norepinephrine, then what you want to do is you want to block those effects. So you give them a beta blocker. So the first thing that needs to happen upon diagnosing someone with Graves' disease is to make sure that you protect the heart, and they are placed on beta blockers. And that will reduce the heart rate and the force of contraction of the heart, and therefore blood pressure, right? Now, how do you diagnose this? Well, you look at their history and their physical. They're going to come in, they're going to complain that they've lost weight and they're really not sure why. They're going to have an enlarged thyroid due to the hypertrophy of the thyroid gland. And they're going to have an extremely low TSH. Now, let's look at this. Right? Remember, you got gland master P, the pituitary gland. Now, this is a negative feedback mechanism, right? So if you look, thyroid stimulating hormone is going to stimulate the production of T4, and then T4 goes to the liver and is converted to T3. Well, if you produce T3, then that's going to feed back on the anterior pituitary and begin to tell the anterior pituitary to stop producing TSH. And that's what happens. Now, if you are artificially producing T4 and T3 because you have Graves' disease and those antibodies are stimulating the TSH receptors, then you're going to have high levels of T4 and T3. So they're going to massively feed back on the pituitary to say, look, we don't need any more TSH. So your TSH is going to be very, very low, and then you're going to have elevated levels of T3 and T4. So that, and a lot of people get that mixed up. Remember, TSH stimulates the thyroid gland to release T3 and T4, right? It has other functions, but in this case, that's what it is. So if your TSH is low, that indicates hyperthyroidism. If your TSH is high, that indicates hypothyroidism, right? And I'll explain that when I get to hypothyroidism. Now, elevated T3 and T4, explain that. Elevated antibodies, those are specific for Graves' disease, so they can actually measure the antibody that's circulating in your blood to make that diagnosis. And the treatment for hyperthyroidism, along with Graves' disease, one of them is the taking of radioactive iodine. Now, radiation destroys cells, and if you recall, the only cell that takes up iodine is the thyroid gland. So by attaching radioactive material to the iodine, when you ingest it, it's going to get digested, absorbed into your blood, and its target cell is going to be the thyroid gland. So once it's taken up and the iodine is removed, the radioactivity will destroy the thyroid gland cell, right, the thyroid. And as a result, the person who was hyperthyroid will now become hypothyroid because you've destroyed the thyroid gland. And this can take, weeks or months. In the meantime, what will happen is they'll monitor your TSH, T3, and T4, and as it begins to drop, and it drops below the normal levels, then they'll start supplementing you with thyroid medication. So you'll have to take synthetic thyroid for the rest of your life. The other treatment is propylthiouracil, and basically what that does is that prevents the thyroid gland from making T4. And it also prevents the liver from converting T4 into T3. And because it's kind of toxic to the liver, these people have to have their liver enzymes monitored very quickly. And methimazole, you got it. And basically what that does is it prevents the formation of T4 in the thyroid gland. And one of the ways it does that is by inhibiting the iodine pump. Then there's another drug called percolate, and that blocks iodine pumps. So no iodine, no T4, no T4, no T3, your thyroid is reduced. And again, thiocyanate is another one that blocks iodine pumps in the thyroid gland. Most of the time, if it's Graves' disease, the most effective treatment is the radioactive iodine. Now, some people may not be able to take that. They may have cancer or other things that prevent them from taking radioactive iodine. If that's the case, then they'll use one of these other treatments. So that's hyperthyroidism. So remember, Graves' disease is basically hyperthyroidism. So it's going to go with the signs and symptoms of hyperthyroid, but there's a specific cause for that. Now, hypothyroidism. Now look, the most common cause is Hashimoto's disease. Now in this case, Hashimoto's disease is also autoimmune. And basically what it does is, instead of the antibodies stimulating the TSH receptors, the antibodies will actually destroy the receptors along with the thyroid itself. So these antibodies will actually start attacking and destroying thyroid cells. Now look, you store T4 in the thyroid gland. So in the early stages of Hashimoto's disease, where these antibodies are attacking and destroying the thyroid gland, it can cause the release of T4, which will then go to the liver and be converted to T3. So in the early stages of Hashimoto's disease, people can develop hyperthyroidism. And you have to watch out for that too. And again, these are specific antibodies that can be drawn into the blood. But the first effect of the antibody is to attack and destroy the TSH receptors. So that's why they develop hyperthyroid or hypothyroidism. So Hashimoto, hypo. So let's look at some of the signs and symptoms of hypothyroidism. All right, so you're going to get weight gain, right? So remember that thyroid hormone increases cell sensitivity to epinephrine and norepinephrine. It also increases protein synthesis in all cells, and it makes cells more leaky to sodium and potassium. Now, if you're hypothyroidism, right, if you have low thyroid, the cells will become less leaky to sodium and potassium, right? Less leaky. As a result, the sodium potassium pump doesn't have to work hard, so you don't need to make ATP. So there's going to be a drop in the metabolic rate. Now, you're also going to get some effects of sodium and the osmotic effect of sodium, so they tend to get puffy, and that is the effect of the osmotic effect of sodium being drawn in, right? They're going to be tired, cranky all the time, mental sluggishness, because again, they're going to have the decreased levels of epinephrine and norepinephrine, right? And then low heart rate and blood pressure for the same reason. The cells become now less sensitive to epinephrine and norepinephrine. And the dry skin due to the decrease in cell division. So the cells of the skin that normally slough off now have time to become highly keratinized. And then coarse fine hair, right? Because of the increased keratinization, but the hair doesn't, the basal layer of the skin doesn't divide that well, so the hair becomes coarse, but when it falls out, it doesn't get replaced. And they're going to have decrease in GI activity. So the symptoms of hypothyroidism are almost identical, or the opposite of hyperthyroidism. And how you diagnose it, basically clinical history, right? As you get older, the risk for hypothyroidism increases. And then you can get a goiter, and that is a result of the thyroid trying to hypertrophy to pump out more thyroid hormone. And the labs, they're going to have the elevated TSH, right? And low T4 and T3, and low levels of free T3 and T4, and low levels of T4 bound to that protein. So hormones are transported in the blood either as free, floating around freely, or bound to a protein. If it's bound to the protein, it's metabolically inactive. But what happens is the amount of free T4 starts to drop. Then the bound T4 will jump off the protein and become free. So that's how they test that. And again, if it's low, T3 and T4, then your TSH is going to be elevated, because if it's low, then there's nothing to feed back to the anterior pituitary saying, look, we got enough thyroid hormone. Well, in this case, you don't. So the anterior pituitary is going to continue to dump out TSH. And that's very important that you understand that, right? So in hyperthyroidism, the TSH is decreased. In hyperthyroidism, the TSH is elevated. So those are the signs and symptoms of hypo and hyperthyroidism. And again, Graves' disease is hyperthyroidism, so the signs and symptoms are the same. Now, the treatment for hypothyroidism is to replace that thyroid hormone. So they're given levothyroxine or Synthroid. So, and then that has to be closely monitored. So once they start it, the blood tests, you should test T3 and T4 free levels, and you should also test the TSH in about 6 weeks to make sure that they're not becoming hyperthyroid. So those are the signs and symptoms of hypo and hyperthyroidism, and the treatments for them.